All right, so for next up, we are just trying to look at investigations that could be done for gynecological issues. So for these investigations that could be done for gynecological issues, we are just actually trying to like classify them. So when we classify them, it helps you know them better. You understand? So we are classifying them into the general and the specific investigations. General investigations, also specific investigations. So of course we are just listing them, we're not discussing them in depth. You understand? So we'll come back later and talk about each one of them. Okay, that's when the in-depth discussion will actually go on. So to investigate gynecological conditions, clinicians typically follow a structured approach. There's a way you should go about it. Do you understand? It shouldn't be scattered, it should be tailored, it should be according. Alright? So on the baseline, on the first thing you are supposed to do is you are supposed to take history. So taking history, you ask the patient things like their menstrual history, you ask them about sexual history, you ask them about obstetric histories like pregnancies, miscarriages, you ask them about the symptoms they have been experiencing. Okay, then from history taking, you go to what? Physical examination. All right. So general examination, where you take note of the vitals, you take note of the signs of anemia, you take note of if there's any issues with hormone. Abdominal examination, where you check out for masses, check out for tenderness. Pelvic examination, where you try to pick up any issue that might be wrong with the pelvis. So you can see it. So laboratory test, all right, you go into blood tests like complete blood count. These are still the general, right? Still the general. So complete blood count, erythrocyte sedimentation rate, C-reactive protein, all of that you are trying to pinpoint if there's inflammation. They do hormone test, hormone profile, follicle stimulating hormone, luteinizing hormone, estrogen, progesterones, and all. Okay. Then also urine tests. Okay, you may also be doing it to check out for human coronary gonadotropin. So vaginal and cervical swabs. Then you go in for imagings. Okay, ultrasound, MRI, CT scans. Okay, cytology. You go in for pap smear, human papilloma virus testings. All of this you go in for it. Then for the specific tests, okay, this one, like you picked up a condition, so you're trying to do a specific test for it. So abnormal uterine bleedings, you can do endometrial biopsy, hysteroscopy, pelvic ultrasound. If there's a pelvic pain, you might actually want to do laparoscopy, where you open up to check, or pelvic ultrasound or STI screenings. There's infertility, you go for hormone profiles, hysterosalpingography. Vaginal discharge, you do wet mounts, pH testings, cultural sensitivity. Suspected malignancies, you can do colposcopy, cervical biopsy. They check out for all those markers, biomarkers. If there's a suspected, menstrual irregularities, you go in for thyroid function test, prolactin test, then polycystic ovarian syndrome test. Then if there's a suspected endometriosis, laparoscopy is gold standard. MRIs too. Then postmenopausal bleeding, transvaginal ultrasound, then also endometrial biopsy. All right, they are strongly suspecting that maybe there's a cancer and so on. All right, so that's what we have, talking about the two types of investigations that might actually be done for gynecological conditions.